some of the fabulous work they're doing for the wider Bendigo community, indeed for the whole Northern Mallee region. I'll speak briefly. I think Bob Cameron, as the chair of the board here at Bendigo Health, will also speak, and then we'll be very happy to take any questions that you may have for us. In terms of, I'd like to start really by just welcoming the ATAGI announcement that was made overnight, which now means that 16 and 17-year-olds in Victoria who've already had their 2 doses of the vaccine are now eligible to get their 3rd dose. So joining everybody who's currently aged 18 and over, who's eligible to get their 3rd dose, it's now been extended to 16 and 17-year-olds. That means that as of right now, as of today, 114,000 16 and 17-year-olds in Victoria are eligible today to get their 3rd dose vaccine, 3 months after they had their 2nd dose. And we believe that's, as I said, about 114,000 people. There's a total of 146,000 16 and 17-year-olds in the state. The others will become eligible as their 3-month anniversary comes up over the weeks ahead. So really good news to see more people being incorporated into the 3rd dose program. That gives us all much greater protection going forward. In terms of 3rd doses so far, now almost 2.2 million Victorians have already had their 3rd dose of the vaccine, and can I thank all of them for getting themselves organised and getting on and getting the 3rd dose done. It's such an important part of our onward protection that we maintain our vaccine status, that we maintain our vaccines and maintain an up-to-date status of our COVID vaccines, so that we can be confident of overseeing the waves of Omicron we're dealing with at the moment, and anything else that might be coming around the corner as we see COVID continue to morph and develop around the world. That means we've got around 41.5% of the entire Victorian population aged 18 and over who've now had their 3rd dose. But actually here in Bendigo, those numbers are even better, and I'll come on to that in a moment. In terms of the other big piece of work we're doing, of course, is that 1st dose of paediatric Pfizer for 5 to 11-year-olds. Now 270,000 5 to 11-year-olds statewide have had their 1st dose of the vaccine, including a number that are being done next door to us right now, which is really good to see. That's 46%, over 46% of all 5 to 11-year-olds are now done. In terms of age profiles, so 3rd dose rollout now, 2/3 of over 70s have had their 3rd dose, and over half of over 50s. So we are starting to see those numbers improve and increase as we go forward. In terms of then, there are still lots of opportunities to get your vaccine appointments done over the days ahead. We've got almost 250,000 vaccine appointments for people across the state at the state clinics over the next 30 days, with over 50 clinics running, as well, of course, as over 1,200 GPs and pharmacies. We'd really like to encourage people, if you haven't had your 3rd dose yet, please get it booked in. You can get an appointment today at one of our state clinics. You can certainly get appointments also, of course, through our primary care partners. But please, wherever you want to go get it done, please just get it done in the days and weeks ahead as you become eligible. In terms of 5 to 11-year-olds, there are 32,000 5 to 11-year-old appointments available just in the next 7 days. Here in Bendigo, there's 4,000 appointments available in the next 7 days for 3rd doses, and 750 appointments available for 5 to 11-year-olds again in the next 7 days. So particularly with the kids going back into school, with a good proportion of them having had their 1st dose, we'd really encourage parents to make sure that this coming weekend we can get your child vaccinated if they haven't been done yet, or make an appointment for next week. But please, let's just go and get it done. And then in terms of why is this also important, and again, sadly today we're still seeing 752 Victorians in hospital with COVID, and although that number is lower than where it's been over the last few days, that's still 752 Victorians and their families worried about their health, and of course the clinical care that they need to deal with what is a very significant condition for them. 82 of those 752 are in ICU, and I'm afraid I'm sad to report that 34 Victorians are recorded having passed away with COVID in the last 24 hours. And we send our thoughts and condolences to their families and loved ones at this really, really difficult time. And that is a reality, I'm afraid, of that we're still seeing with high numbers of cases. 12,157 COVID cases today, newly reported in the state. About half of those on rapid antigen tests, about half of those on PCRs. It's still a very real condition, which does have medical complications for a small number of people. The best protection, of course, is to get the vaccine to give you the best chance of avoiding those really serious consequences. Finally, what we're seeing here, particularly in Bendigo, is a really good use of rapid antigen testing. Our testing sites here are running about 50-50 between PCR tests and rapid antigen tests. And I thank people, in particular those who are using those rapid antigen tests, whether you've got them through school, whether you've got them from our testing sites, whether you've got them through other distributions that we're doing. The fact that people are using them and also, of course, reporting those positive results to us allows us to provide clinical support to those people who are positive to make sure they get the help they need to get through with COVID. Finally, in terms of rapid antigen testing, we've now allocated 23 million of those tests have now been received in the state, part of our order of 200 million tests, so 23 million received over the last 3 or 4 weeks, all already being actively distributed through our various networks, because many of them now going to schools, 6.5 million distributed to schools, but also a lot of them going into our health services, community health providers, our sensitive and high-risk and vulnerable communities, and of course our testing sites. So certainly if you are listening to this and you need to get access to testing, come to our PCR sites here in Bendigo. We've got no more than 15-minute waiting times at the moment, and you will either get a PCR test or a rapid antigen test, and depending on the symptoms that you have. With that, I might hand over to Bob, and then we'll take any questions. Bob.
Good morning. I'll be very quick. But the booster rate is moving along extremely well in Bendigo. So of the eligible population, the 16+ population, we're going to be at 50% today. So that's well ahead of where a lot of other people are around the nation, and that's a great credit to Bendigonians. And I think, as a result of a very high double vaccination rate, is now sort of one of the leaders when it comes to boosters. That's why we are starting to see the numbers in hospital drop away. We still do have 14 people in hospital today, but we have 159 in the hospital, in the home, people who need to be well monitored. So, to Bendigo, congratulations, you're doing a fantastic job, and what you're really doing is helping us to protect the health system and make us be able to move forward to the next stage as soon as possible. We'll open up to questions. Jerome?
Thanks, Bob. Can I just add my thanks and congratulations to Bendigo and the whole team here at Bendigo Health, from the testing teams, our contact tracing teams, our community engagement teams, and of course the vaccination teams. I'm here in front of the vaccination tree. All these literally thousands of Bendigo children with their stickers on this tree showing that they've had their vaccine done. There's quite a few of these trees now starting to sprout leaves all across the state, and fantastic to see half of the Bendigo community having had their third doses already, and that's thanks to the fantastic work of Bendigo Health and their many partners across the community. Questions?
Do you anticipate with the numbers jumping around that's a result of schools going back?
Oh yeah, look, I think we always expected there to be, a stabilisation on numbers, particularly with schools going back, a lot more movement around the community. We are seeing we're seeing an increasing proportion of the positive rapid antigen tests we're seeing every day with coming in people under the age of 20. So presumably a significant linkage into our school age population. So we expect to see these numbers bounce around over the next couple of weeks as the schools settle down. We're obviously working very closely with school communities to not only all those COVID safe measures that the schools have put in place, but also encouraging the school communities to make good use of those rapid antigen tests that have been distributed to them.
370 teens became eligible for their boosters after the Pfizer announcement. How many of them are Victorian? In the country, out of the 300?
Yeah, there are now 114,000 16 and 17-year-olds in Victoria who are eligible right now to get their third dose. It's been more than 3 months since they had their second dose. There's another, I think, 30,000 or so 16 and 17-year-olds in Victoria who will have to wait a few more weeks while they get to their 3-month anniversary off their second dose.
The third booster isn't linking to the Vic Services app, but it comes up on the MyGov app. Will we soon get it linked to the Vic Services app?
Yeah, there's a lot of work happening at the moment on the Services Vic app, which of course is a good way to store your vaccination certificate. The core data is held in the Medicare app and the Central Commonwealth Government sort of Medicare app, which is where you can hold your immunisation status. But then we are updating the Services Vic app, which will then include the additional fields to show the third dose and any further doses that are needed as we go into the future.
In the height of that first and second dose vaccine rollout in Bendigo, I think we were seeing, Bob, maybe every week about milestones that Bendigo is hitting. Can you tell us how the Bendigo region has compared to other areas and what you think of our vaccine uptake? Yeah,
look, I think without at risk of putting those that are joint across the state, I think the Bendigo region has absolutely smashed the vaccination program both time around. So first and second dose uptake was really strong and really fast. And again, I think Bendigo will be one of our first regions to hit 50% of people who are getting their third dose. That's a great achievement of the whole Bendigo community, and that's how we stay on top of these positive COVID positive cases. And we're still seeing new active cases in Bendigo. I think there's 157 new cases today in Bendigo. There's there's about 1,100, I think 1,186 active cases in the Greater Bendigo area. So COVID is very real in this community, as it is in every community across regional Victoria. But great to see the pace and the momentum, and just meeting the teams here this morning. The strong desire we've got to get people vaccinated, and people coming forward in numbers is exactly what we want to see.
We've had it confirmed that a couple of schools in Bendigo haven't had enough RAT tests. Can you speak to that, and have you seen that in other places as well?
Yeah, so look, I'd be surprised. I know that we certainly had 6.5 million RAT tests coming out of our warehouse about 10 days ago, going into the education system, and I know that our education colleagues in our schools have been working frantically during the holidays to make sure that all those 6.5 million tests get to the staff and students of all of our primary, specialist and secondary schools. I'm sure there will always be some individual challenges on individual schools, and my thanks to them for getting on with it. If there's any particular schools that have got real challenges, please speak to your government contacts to make sure that you can get your allocation to you this week. We're really keen to make sure that every school student in primary, specialist and secondary has got access to RAT testing for the first week, so we can be confident that if there are any positive cases out there, that we catch them really early and we minimise the spread in schools.
Do you believe we're past the peak of hospitalisations?
Yeah, look, I mean, obviously I'm not a clinical specialist, but certainly talking to the Chief Health Officer and catching up with our health service CEOs in the last few days, I think we're generally seeing, if you look at the numbers now, we peaked at around 1,500 hospitalisations about 2 weeks ago. We're now at around 750. We think those numbers will be volatile. They won't continue to go down at the rate we're seeing at the moment. But obviously, it's great to see them in a much better place. We do think we're past the peak at this point in time. We'll be interested to see how the next few weeks go, as we see probably greater levels of movement around the community. Schools going back is a really important thing for us, but it does mean there'll be more people circulating. We'd expect to see some more cases, and hopefully not many of those will translate into hospitalisations. The best way to avoid hospitalisations is for as many of us as possible to get our vaccine done.
So how do you think we'll fare in winter?
Well, look, I mean, there's a lot of preparation and planning now going into the winter months around how we ensure we get ready for that. There's a number of scenarios we're working on. So again, we'll want to make sure that people have got their third doses done and complete before we go into that autumn-winter period, because there will be future challenges ahead. We're also preparing scenarios around potential new variants that may come in, and what measures we need to have in place ready to go to protect the community. But it will come down to the usual things that we've all now had plenty of time to get used to. So it's the basic COVID-safe measures around social distancing where possible, hand hygiene, mask wearing indoors when you can't socially distance properly, and making sure your vaccine status is up to date. Those will be the hallmarks of how we get through the months ahead and how we get through the winter later on.
So has Omicron taught you that you need to be better prepared for variants?
Oh, look, I think that we've been preparing for variants all the way along this COVID pandemic, right all the way from the Alpha strain that came through and hit us about 12 months ago, through Delta, and now through Omicron, and of course the various subvariants of Omicron. We'll continue to be ready for any types of variants that emerge. And look, I think all of us as a community want to be done with COVID. I absolutely get that. Nobody wants to be talking about this anymore. We all want to get on with our lives. But if you look at the way we're responding to the Omicron variant now, where our schools are open, our shops are open, people are able to do all the things they need to do, there are some limited restrictions in place, but only those very minimal ones to really minimise those large super spreading risk events. But it also requires all of us as Victorians to do the things we need to do, and that's the basic measures of wearing masks indoors and good hand hygiene and getting your vaccine done. If we all do those things, we can manage the variants that come down the road.
As we move closer to that 50% boosted dose, when can we expect that boosters become mandatory?
Well, look, there's various conversations, my understanding is taking place at National Cabinet around the requirements around third doses. I think at Target taking some views as well around when we start to regard the fully vaccinated stages as being not 2 doses but 3 doses. And I think certainly our expectation in the Victorian Department of Health would be that we will be moving into a world where to be fully vaccinated will mean having 3 doses. If there are further measures that are needed beyond that, we'll make those announcements at the time.
How soon will that be, in the next few weeks or months?
So we're waiting on the Target to make some to do their work and to make some findings. I think that will go to National Cabinet, so we'll wait and see the results of those processes. But I think all of us as Victorians, what can we do of ourselves? We can control whether we've been vaccinated for the third dose or not. I think we should all expect that to be something we're all going to have to do. The sooner we do it after our third dose, the sooner we do it when we become eligible for our third dose, I think the better that will be. It'll help us control the current Omicron wave and get us ready for the autumn and winter months ahead.
And we know New South Wales has announced that elective surgery is coming back.
Yeah.
What are conversations like for Victoria? Are we close to making the same announcement?
Yeah, look, it's not directly in my wheelhouse, but certainly I'm aware that conversations are taking place across our health system. Obviously, what we have to balance is, we still have 752 Victorians requiring, strong and supportive care to deal with their current COVID conditions. We've also got significant challenges around workforce at the moment, with significant numbers of staff either furloughing because they've been exposed to COVID, or with other seasonal issues. So there are significant and continued pressures on our healthcare system, but those issues are being reviewed on a daily basis by the leaders of our health services, and decisions will be made, I think, and announcements made over the days ahead.
And is that the same for Code Brown? Are we going to keep having that as well?
Yeah, again, that again continues to be under review. Look, none of us want to be in a world where we have to limit and minimise elective surgery, or whether we have to put constraints on the rest of our healthcare system. So, we are going through what we believe at the moment is the very peak of the pressure on the whole of the healthcare and hospital system. Yeah, and our workers, our frontline workers across our health services, have done an amazing job, particularly over the last 5 weeks. Where after an exhausting 2 years, people have had to step up again over that Christmas and New Year period, at a time when we all want to be on holidays, and to be there providing care under a system which is under intense pressure. That pressure is starting to ease off a bit, and I know we'll want to reinstate any other services as soon as we possibly can.
Just on that note with the Code Brown, a question for Bob. How's it affecting Bendigo Health, and is it still necessary with hospitalisations dropping?
Well, the entire health system wants to get back to normal, but to be able to do that, we have to be able to have the staff. And at the moment, we have around 50 a day who are on furlough, either because they might have COVID, or they're living in a household where somebody has COVID. And we expect that with school going back, that will bump up a little bit more. But we hope that after that, we will then be in a position where we can be having a discussion with the health department as to a way back. And look, everybody wants this. We want this. The community wants this. The health department and the government want this. And I think if we all work together, we'll be able to get there as soon as possible. Can I just say that having Jerome come up today has been fantastic. He's able to see the way that we work in this region, but he is in constant contact with all of the regional hospitals as well as the major city hospitals, so he has a really good understanding of what goes on in the state, and the health department does it as well. So I think people need to be assured that this will get back to normal as soon as possible because of all the work that's being done.
Are there still children being hospitalised at Bendigo Health for COVID?
I don't think we've got any at the moment, have we? Children? Got any children with COVID at the moment? No, I don't think so. Yeah.
How's the hospital in the home program been going, especially as we kind of went through that peak? Did you have to adapt in any way how that was delivered?
Well, we at the moment are 159 that are being monitored through the hospital in the home program. That's probably going to head along in that direction for the time being, and certainly with probably a greater spread because of schools going back, that probably go up a little bit more before it starts to go down. And the thing is, the best thing that people can do is make sure that they got the booster, because if you've got that up-to-date vaccination, in all likelihood, you won't need to use that program. So, we're going to be at 50% today in Greater Bendigo, but we want to see more so that we can even get those numbers down lower.
Great. Thank you. Thanks.
Awesome. Thanks, guys. Thank you.
Could I get a photo, please, gentlemen?
Yeah, sure.
Yeah. Yeah. Is that all right? Thank you. Yeah, that would be great.
Did all the kids write their names?
Yeah, it looks like it.
Oh, yeah. Right.
We're going to stick with these.
All right.